Alaska Natives and Alaska Indians are Indigenous people. There are 573 federally recognized American Indian and Alaska Native tribes and villages in the United States. Alaska Natives and Indians comprise 15% of Alaska's population and the highest concentration of anywhere in the country. For the sake of time, I will refer to Alaska Natives and Alaska Indians as AIAN for the remainder of this presentation. This population is rich in Alaskan history and culture. They have a deep respect for the land and strong extended family ties. Unfortunately, this population has the highest rates of suicide of any racial ethnic group in the United States. Indigenous youth aged 15 to 24 make up 24 of the 100,000 suicides per year, 4 times higher than the national average. These numbers are even higher in rural Alaska. Identified risk factors within this specific population include mental illness, homelessness, substance abuse, and criminal association. In the state of Alaska, this population holds the highest percentages of alcohol deaths and sexual assault. Furthermore, these Indigenous students graduate at a level 8% lower than the state's already low graduation rate. Prevention and intervention efforts have not adequately addressed the disproportionate suicide rates amongst this population. Approximately 70% of AIAN youth live in non-metropolitan or rural areas. The further out they live, the higher the risk for suicide. For every 5-degree increase in latitude, the suicide rate jumps 18%. The state's remoteness has an impact on accessibility to mental health services, hospitals, and basic health care. 82% of communities across Alaska are not accessible by road. Rural areas have provider shortages, and a suicidal crisis often results in individuals having to travel 200 to 300 miles to a larger village or city. AIAN youth with mental health needs have lower odds of receiving mental health diagnosis or mental health support after a suicidal crisis. This was the unfortunate case with Rosie Hadley, who lived in rural Alaska in 2016. Shortly after Rosie graduated, she headed to college at UAA in Anchorage. Before Christmas break, she dropped out of college and returned home. Within days of returning home, Rosie was medically evacuated from her small village to a Kotzebue hospital after an intentional overdose. Rosie was discharged the next day and flown back. She lived with her aunt, worked, and continued living in the small rural village. 2 years later, Rosie committed suicide at her aunt's home. In the months to follow, the village experienced 3 more suicides. Rosie's story is unfortunately common. She received no follow-up care, mental health services, or counseling following her return home from the hospital. Furthermore, her suicide had a ripple effect on the village. Suicide contagion or copycat suicides are associated with friends or family members also attempting or completing suicide. Villages are ill-equipped to deal with mental health issues and the aftermath of suicide. Additional factors that may influence this demographic could be connected to the atrocities Alaska Indian and Native populations endured throughout the years. Under the appalling ideology of kill the Indian, save the man, these federal laws and policies prohibited tribes from cultural traditions and basic way of life. Many of these federal policies led to the boarding school era, and this had devastating consequences for AIAN children, their families, and their communities. Several generations of children were removed from their homes to attend these boarding schools. These children became adults without the benefit of understanding necessary parenting skills or how to exist as a contributing member of a community. This deficiency of traditional parenting skills has allowed trauma to be passed down for generations. The sexual, physical, emotional, and mental abuse that was experienced by many boarding school students continues to have a devastating impact on this population today. When the victims returned home to their communities, they often brought these abuses with them, which has contributed to the current state of Alaska Native families and tribal communities. I feel strongly that historical trauma continues to impact the disproportionate suicide rates for Alaska Native and Indian youth. Alaska is taking some steps to address this need. The Alaska Resilience Initiative, ARI, is a network of nonprofit, tribal, state government, and community partnerships working to solve complex social problems and promote a healthy, just, and resilient Alaska. Through a federal grant, ARI is actively training Alaskan teachers to be trauma-informed and knowledgeable about adverse childhood experiences, or ACEs. AIAN populations are disproportionately affected by childhood trauma. Many Alaskan schools are opting to become trauma-sensitive schools where educators can better understand ACEs and precisely how they affect Alaskan children. Educators also learn how the results of this trauma show up in the classroom and how to use trauma-informed practices in response to ACEs. The Alaska Native Tribal Health Consortium is another nonprofit health organization based in Anchorage. In 2018, they received a grant to partner with the Substance Abuse and Mental Services Health Association. Part of the grant monies are earmarked for suicide awareness and changing the conversation about suicide. Speaking openly about feelings is not the cultural norm for this population. However, tribal leaders are beginning to realize that the conversation about suicide must change. They recently produced a short but very powerful video as part of a new curriculum in rural Alaskan schools. I thought it was worth sharing.
For thousands of years, our people walked these lands. They hunted, fished, gathered. Every day they knew that their survival depended on each other. When they rested, they would celebrate their ancestors and tell their stories. They made it possible for us to survive in this land. Stories and traditions passed from one to another are at the heart of who we are. But when we are gone, who among you will pass on this knowledge and wisdom? You are the bridge. You are the stories. You are the heart. If you are facing the mountain you can't climb, don't give up. If you are hurting in your heart, don't be silent. If you are thinking about suicide, don't give in. You have the strength of generations in you. You are needed. To talk to someone who can help or to help someone you know, call or live chat the National Suicide Prevention Lifeline. Call 1-800-273-TALK.
These programs are proving that connections to ancestors and traditions can help guide youth to overcome pain, silence, and the stigma associated with discussing suicide. There are many supporting agencies and organizations that help Alaskan youth. Covenant House provides services and shelter to homeless or at-risk youth in Alaska. It is heartbreaking to walk in downtown Anchorage and see the reality of homelessness, and many of these individuals are very young. Every year, AIAN teens transition from villages and become homeless. Covenant House not only provides shelter, they offer mental health services, high school diploma programs, job training, and long-term residential programs. Last year, 1,400 youth visited the mental health support program at Covenant House. Almost half of the people served at Covenant House are AIAN. Beacon Hill is a nonprofit that supports foster children and families in crisis in Alaska. Well over half of Alaska's foster care system are AIAN children. Beacon Hill works very closely with the Office of Children's Services. A school counselor could provide immediate support to any of their students in foster care by simply calling a staff person at Beacon Hill. And of course, every counselor working in the state needs to have the Alaska Careline number available. This local chapter of the National Suicide Prevention Network provides free and confidential emotional support to people in suicidal crisis or emotional distress, 24 hours a day, 7 days a week. A counselor's role working with these students could be vital. When students transition from rural Alaska to the Anchorage School District, often they have limited support and are unable to advocate for themselves. Unlike rural Alaska, Anchorage does have mental health resources for hurting students. Counselors should be ready to meet the needs of these vulnerable students, including knowing exactly where to send them for mental health support. Besides the organizations previously mentioned, Alaska Native and Indian students have access to many resources through the federally funded Migrant or Indian Education Program. Many Anchorage School District schools have migrant education departments, but if not, the counselor should be knowledgeable about this program and make sure students are enrolled. Migrant Ed students have access to many services, including a comprehensive mental health and social services network. A counselor can assist students in filling out the one-page form online, have instant access to many services, including credit recovery, high school classes, test prep, tutoring, summer school, extracurricular programs, and importantly, social services that has a myriad of support services. Furthermore, migrant education allows educators to augment and supplement assignments in schoolwork for AIAN subsistence students. Students who leave the school year early to fish or hunt may set up performance-based or portfolio assessments. They can do this with their counselor in lieu of taking a traditional final. Students could report on real-life skills, and keeping these students on track academically keeps their emotional health in a better state. In conclusion, I would just say all of the programs, activities, and data in the world cannot take the place of caring. We all have heard the quote before, "Nobody cares how much you know until they know how much you care." But I find it to be so relevant. Counselors that have the trust of their culturally diverse students will be far more likely to encourage honest communication that could assist a student in suicidal crisis and get students the help that they need.